Welcome. Thank you for joining us today. This is a question and answer session for February 19th. Public Health Director Annette Rodriguez and Dr. Chris Burr are addressing questions received this week. Please feel free to add your follow-up questions to chat. Start off by saying I hope everyone has remained safe and warm, or at least is warmer now. Today's questions are going to focus on vaccine logistics in Texas, efficacy, and a healthy lifestyle check-in. Dr. Burr?
All right, thanks everybody for tuning in. We have questions that you asked that we're going to go through, but I'm going to go off script because I've got questions I think everybody wants to know the answer to. And hopefully Annette has the answers, and she's back. All right. So Annette, this freeze and electricity outage and everything how has this affected the supply of vaccines? Have any vaccines spoiled from the state that you know of? Do you know anything about that?
Fortunately, we didn't have any vaccines. So speaking for ourselves here, currently in Corpus Christi, we had already utilized all of our vaccines. We vaccinate with a sense of urgency to get them in arms as quickly as possible. And it worked to our advantage because, this event did come up. We also registered people in advance of last week. Unfortunately, vaccine didn't show up. So while we have no vaccine in our coffers, vaccine did not show up because of the weather and, to be expected. The state did send us out something early in the week saying that we may receive vaccine as early as Wednesday, Thursday, Friday, or Saturday. Today's Friday. We still have not received anything. We don't believe that we will receive anything this week, but we're thinking ahead that next week we will receive vaccine for this past week, which was a real disaster for the whole state of Texas, and I hope everybody is safe. But also we will receive vaccine, we're believing, for the week of next week. And so what that means to people in Corpus Christi and Nueces County is that's 10,000 first doses and that's 10,000 second doses. So what I want to tell people is if you thought you were supposed to be scheduled last week for 4,000 first doses, do not worry. We still have your name in our data bank, and we will be reverse alerting people. We just need to receive vaccine to be able to do that.
All right. With 10,000 vaccines, do you have any goal of maybe beating Dodger Stadium of doing 7,800 vaccinations in one day?
We really don't have that goal at this point. So what we do want to do, though, is if we receive the vaccines and if we receive 2 weeks of worth of vaccine, last week's and this week's, on Monday, we want to start having our vaccination clinics on Tuesday, Wednesday, and Thursday. And so our real goal is to get rid of the first 10,000 vaccines very quickly because those are first doses. Those are the ones that the state looks to see how long it takes us to give those first doses. And the quicker we give it, supposedly, the more vaccine we'll receive. And so we constantly want to keep moving those first doses and putting them in people's arms very quickly.
All right, that sounds good. And I think an important point you made that I want to reiterate or rephrase is that vaccinating with sense and urgency was really important just for combating the virus, but also when something unforeseen comes up, you don't know when power will go out or somebody will leave a freezer open. So you don't want to be, if you're a provider, you don't want to be storing that vaccine for long periods of time. You want to store that in people's arms rather than in a freezer that's prone to breaking.
Right. Yeah, I think on top of that, Chris, we did have one provider that reached out to us that they couldn't use their vaccine. We're talking less than 20 vaccines. But they don't also know the importance of getting it in people's arms. So they transferred it over to us today just to make sure that we use it before the expiration date. And we will do that, definitely. We'll probably use it in the next couple of days.
All right, excellent. So there's a place we have unused vaccine. You can give it to the public health department, right?
Mm-hmm, absolutely.
Okay, so the first question, I'll go through them. I know you answered some of them already, but the first question is, will the public health department be receiving week 10 COVID-19 vaccine allocations this weekend? I think you already addressed that, saying maybe, but it seems like we will be getting them at some point, right?
Right, that's definitely our hope. You know, the state is currently closed. They're also going through this terrible weather event, the Department of State Health Services in Austin. And so they're currently closed. So we kind of feel like we're kind of left in the dark. And so we're waiting just like everybody else to see something, on our system. The other part to this is that our system, which is called our VAO system, our vaccine allocation ordering system, has been down all week because of the weather. So we haven't been able to see any updates on, where is vaccine, is it being shipped? What we heard a couple of days ago, the state actually was calling places that were going to be receiving vaccine. We were not on that list to be called because they shared the list with us. And so we do know that they were still doing everything in their power, even without electricity and without, all these other things that we're used to having in the United States. And they were still doing everything in their power to make sure that vaccine got to the right places so those places could turn around and start putting it in people's arms.
Right. Okay, let's see, moving on to the next question on efficacy, which I'll field this question, and then Annette can correct me if I make any mistakes. So the question is, how effective are vaccines against variants, and are there any updates or changes since last week? And there has been a development since last week that I kind of caught wind of, but I hadn't read everything yet to be sure about it. But I've studied up, and there have been preliminary reports on both the effectiveness of the Pfizer vaccine and the Moderna vaccine against various spike protein variants, including the B1 351 variant. B1 351 variant, which is the one that originated in South Africa. And the punchline of those studies is that both the Moderna and Pfizer vaccines elicit a substantially lower antibody response, or after vaccination, there's a substantially lower antibody response to the South African variant than the other variants. For Moderna, it's about a 5/6 reduction, and for the Pfizer, it's about a 2/3 reduction in antibody production. And the numbers are close enough based upon the sample size and everything that those really aren't differences. So I don't think anybody should read into it that one vaccine is more or less effective than the other. I think they're both in the same ballpark. So that's one thing. Another important thing to consider is this is just about antibody production. It's not about necessarily effectiveness against contracting the disease. These tests were done on blood samples. They were not done in the same way as the first trials, where thousands of people were tracked, and what was the difference between people who received the vaccine or not. This was antibodies elicited from blood samples from people, so it's a different type of study, and the magnitude of the difference in severity of COVID elicited by the variant from South Africa versus other variants is not yet known. We just know there's a reduction in antibodies that might have almost no effect on the difference in the severity of infection by 351, or it might result in a slightly more severe infection from the B1 351 variant than from other variants, and that remains to be determined. I know it's kind of frustrating, but scientists are moving as fast as they can to get you the best answers that they can.
I think the good news is that if you look at the variant that that we know that we have here locally, or that we had, maybe we still have it, maybe we don't. We've only had the one case that has actually showed up as positive, the B117. That's the UK strain, and it's very hard to say these without saying, the place where they've originated from. But that the Pfizer vaccine is effective. And, as we learn more about these vaccines, we learn more about, are they effective against these variants or not? And so Pfizer is effective, and Moderna is effective currently against those, against the UK, the B117.
Right, and let me follow up. I'm going to raise this issue that it's been determined well before this outbreak that viruses are not supposed to be named based upon their locality because it leads to biases against these places. So
Stigmas.
yeah, it leads to a negative stigma. However, what has happened here is the first scientific publication that described these variants used these arcane descriptors of B.1.1.7 and B.1.351 and P.1. And so it's really difficult for us to remember all this, not just a scientist, but everybody. And nobody was really going to know what we're talking about at this point based upon the messaging that's been associated with these variants without us stating the it's almost impossible not to say the South African variant or the UK variant, and we apologize for that, and we understand the importance of not associating a particular variant with a particular location. But at the same time, if nobody knows what we're talking about, then that's not really going to do any good either. So we do our best to state it in the most correct way possible, but it's very difficult.
I think the main reason is because people believe that the Spanish flu came from Spain, and that's not true. But that's become the stigma of everybody calling it the Spanish flu, and so that's why they ask us not to put the place associated with the number. But again, it's just the easiest way to describe it. I think everybody knows the UK strain versus the B.1.1.7.
Right, and for that 1918 pandemic, the reason why it was called the Spanish flu is because Spain was the only country that acknowledged that it was there, and all the other countries were in denial from what I read. So it didn't originate in Spain. It's just the whole rest of the world decided to kind of lay the blame on Spain, if you will. And we want to make sure everybody understands that we're not blaming the countries that are associated with discovering these newer variants. And something I know I've said in our own meetings on the task force is that the reason why these variants are associated with the UK or South Africa is because they were sequencing the variants and testing for it. And I find it highly likely, based upon how much COVID there is in the United States, that there are or will be variants from here, and they weren't discovered before, or they're not going to be discovered now because our sequencing program is not as advanced as it is in these other countries. And pivoting from that to ultimately the take-home message on these vaccines and the effectiveness, the reason why you're all worried about it and asking the questions or concerned is that you want to know how it's going to affect the pandemic. And here's something that I can state with some certainty, being a professor in evolutionary biology, which is that we want to stop these variants from occurring, and the best way to stop them from occurring is to decrease the amount of COVID in the community. So when you're being asked to wear a mask and social distance after you've been vaccinated, the primary reason is to reduce the likelihood that we will get a new variant or a super variant that's resistant to the vaccines. The less the coronavirus that's out there in the wild experiences people that have been vaccinated, the less probability there is that it will be able to evolve into a form that will resist current vaccination regimens. So, we want to beat down COVID. We want to get the numbers way down, and we want to keep doing everything we can to not expose people who have been vaccinated or not vaccinated to COVID, to try to get this thing under control finally and be able to move forward as a society.
Yeah, and I think more like, just to put it in simple terms, if the virus can't replicate, it can't mutate. And so we're doing everything, like Dr. Bird just said, to keep that from happening, the replication. So we're trying not to spread the virus. So we're asking you to continue to follow your public health strategies, wearing your mask, washing your hands, not touching your eyes, nose, and mouth, and infecting yourself. Those types of things help, but as well as getting vaccinated as soon as you're eligible and as soon as there's enough vaccine to be able to get vaccinated.
Right, exactly. Okay, moving on to our ongoing theme of trying to stay in shape during the pandemic, and now the loss of electricity and water, and apparently food at the grocery stores at this point. Annette, how have you made out in this past week with trying to stay in shape?
You know, this past week has been really tough. So, I mean, it's been extremely cold. We took in another family to help them because they didn't have electricity. And so, you know, everybody's trying to cook, you know, to keep people fed and keep them a little bit happier, and just smaller living quarters, if you will, with more people in it, you know, more people needing to use the restrooms. And we had a water pipe that busted like many other people did as well, so couldn't flush, you know, the restrooms, which is frustrating, so having to bucket water in. So, yeah, exercise really wasn't in the whole week's thought process, and I could tell I got on the scales today and gained 2 pounds. How I could have walked miles with that drive-through last week and lost 1 pound, and in 1 week, you know, could gain 2 pounds. It's just incredible. It's just distressing, it's stressful, it's everything else that I could mention. But I guess the good news is that the sun is out, and so every day is a new day, and we just have to just start trying all over again.
Yeah, I'm kind of in the same boat as you. I didn't do any bike riding this past week, but I do realize when I'm waking up in the morning, my core is sore, my back is sore, and that's because at my house we had, you know, same sorts of issues that you're talking about, where we had a massive flood, and I've been just, you know, running around like a madman trying to patch broken pipes, pump out water from underneath my house, carrying the buckets of water to the toilets, you know, so as you carry those 5-gallon buckets, you can do some curls on the way. But all that, I think, is probably, you know, giving me more exercise than I would normally get in the week, because pretty much all I've been doing since Monday is racing around my house trying to patch, you know, leaks in the dike as the water, you know, as the dam's breaking.
Wow. Well, sorry to hear that, but you know, it's kind of amazing, and back to the difference between men and women. So you could be doing the exact same thing I'm doing, and you're losing weight, and I'm gaining. Just incredible.
Yeah, well, I haven't had a chance to step on a scale yet, so I'm not sure if I lost or gained, but I'm definitely sore, so I'm feeling like maybe I lost a little bit of weight. We'll see. But yeah, I mean, it's important to stay healthy and in shape. And one of the comorbidities that gets you eligible for the vaccine right now is having a BMI of 30 or above, and it's shockingly easy to have your BMI be above 30. Especially living in Texas, from what I've found. So you want to try to exercise and get yourself into a point where you're less prone to severe risks, not just from COVID, but there's a variety of other health problems that come with being overweight.
I think the good news is that the hospitalizations have gone down. I think everybody's also seen our COVID cases numbers have gone down. But we don't believe those numbers to be true as far as COVID cases. We believe that to be an effect of the weather. You know, people couldn't get out or didn't want to get out. They're sick, you know, and there weren't as many places open to do testing for swabbing. And so we're seeing really low numbers. What I do know is that we can get there. We can get back into the double digits and even the single digits for COVID cases. And that's really what our goal is and where we need to get. So if we're going to be able to do this, again, we have to do it together. And so keep trying to follow those public health strategies the best you can. We all understand that, you know, the safety of your family and your loved one is, of course, your priority. But always remembering that COVID-19 can also cause problems. It could cause you to have to be hospitalized. And none of us need that on top of everything else. So stay safe and stay warm and take care of yourself, and try your best not to get COVID-19 and not to transmit COVID-19 to others.
Yep. Thank you for that. I think that's great advice. And remember, double mask, especially if you're in the plumbing aisle at one of the home improvement stores locally, because the whole town is in those plumbing aisles right now. The rest of the store is probably very low transmission probability, but that plumbing aisle is the dangerous spot with all the people in there. Let's see, do you have anything else on that for this week?
Again, I think just to reiterate, I don't know when vaccine will be coming in. I am trying to pretend like it may come in on Monday. If it comes in on Monday, we will be having clinics on Tuesday, Wednesday, and Thursday. We have not forgotten the people that signed up last week, those 4,000 individuals that signed up either by calling in or by getting online and registering. Those individuals will be priority to get into our vaccination clinic, but then we will add the other 6,000 people if both weeks' vaccines come in at the same time to get everybody vaccinated as quickly as possible. That's all I have.
All right, thank you. Tiffany and Jason, do we have any questions from the audience?
I'll open it up to the audience. Do you have any questions? So far, no.
Yeah. Yeah, probably everybody's just trying to deal with the cold and shortage of food and things like that. All right. Well, you can always post your questions when you get your power back to our social media accounts. That's CBCovid on Twitter, Instagram, and Facebook. And I'll let Jason take it away and close us out.
Okay. I will say, Annette, that I'm one of those 4,000, so looking forward to your text.
Haven't forgotten you, Jason.
Well, thank you, everyone, for tuning in. The next task force report will be uploaded this afternoon to social media. Please join us every Friday at noon for the question and answer session. Remember to direct your questions or comments to @CBCovid on social media. Have a wonderful, safe, warm, and very sunny weekend. Thank you.
Thanks, everybody. Stay warm, stay safe.
Thank you.